We are recording from the podcast lounge at RDH Under One Roof with the epic Anne Rice.
Yeah.
But I think going back to what you were talking about is hygienists wanting to try so hard with that whole idea of autonomy. We're basically at the mercy of the practice that we work in.
Uh-huh.
That's I don't want to say that's 100% it, but a hygienist can only practice to the scope that her dentist lets her practice in. That's the reality of why, I don't want to say why, but one of the biggest reasons that prevention is being arrested instead of growing, because there's not money behind it for a practice most of the time.
Well, you don't even have the tools to do it.
I mean,
The technology is expensive
I don't know
to
how many
screen.
times I've gone into a practice and it's like, hey, can I order some instruments?
Well, there
you
also
don't
is
need any instruments,
misinformation,
right?
and we heard it recently that hygiene isn't profitable. Well, that's a you business model problem.
Right.
I
If
and
you're
I
treating
understand.
disease,
Yeah,
it's
I mean, we
profitable.
could go back into it's the insurance payment, and I get all that because that's disastrous too. But you can make it profitable. Yeah, I granted a $20 pro fee from an insurance company really is brutal, but we are not. We can be leaders. We can do these different things. And the part when we talked about the veneer person or the
Yeah.
crown and bridge, the cosmetic dentist, and all that. You have got to have a good oral microbiome because your stuff is going to fail. And that patient that just put 20, 30, 40 grand in their mouth are going to be really mad.
Yeah.
Because they just invested all that. Unless that oral microbiome is in check, that's where prevention is. I mean, it's a win-win every which way.
Or an implant. Wouldn't it make sense to be doing salivary diagnostics to make sure that mouth is stable for implants?
Yeah.
Talking crazy.
Before
I know.
you're like,
what is these ideas
it's really
you
hard
have?
to get a perio. It's a perio. Like sometimes I'll talk to like a periodontist or something, and they're like, "Are you doing salivary testing?" No, I wouldn't do that because you're in perio. What are you treating?
Yeah, it is. There's a lot of misunderstanding.
Like it's not going to change my treatment, but it should. Like
Yeah.
you got to understand where the
Who's gonna
where
pay
the disease.
for it, all the things.
Mm-hmm.
I think that when we talk about implants a little bit, there was a new study that just came out where they measured vitamin D and early implant failure, and that would, and I mentioned it in the course that I did. Okay, so then how do we get that out there, right? Do we have a patient go to Quest and get a vitamin D test, and D is really tricky. A lot of people don't absorb even in the best of times, even when they supplement and all the things. Okay, nothing's perfect, but just because that happens doesn't mean you don't do it at all. But what I had said in the course was maybe perhaps if you're not going to test them and you're just going to roll through this and you're not going to, is that you, before your implant surgery, we want you to.
Some practices are doing that.
You need to elevate your vitamin D.
Yeah.
My husband just had a knee replacement. He had an ankle replacement as well. There's a huge list of pages and pages of things that he needed to do beforehand. Protein was a huge thing on this knee recently. It wasn't on the ankle that was 2 years ago. There wasn't that. Now they were different doctors.
Okay.
So protein was really big on this, and I got a shout out there. I don't know who's going to hear it. The hospital that he went through, that group, I am going to lay it out to them. Not once oral health for both of these joints were even in the conversation.
Yep.
That is a really important part that medicine is missing. They did tell him, this was interesting, after he gets his knee, no deep cleaning, that's the verbiage, no deep cleaning for 6 months.
Shouldn't we check that before and make sure
Right.
the biome is
well, and then the other part of that too was, and I heard somebody mention it, I was in a course about getting clearances. Welcome to reality. Doctors don't ask for clearances hardly at all anymore.
Yeah.
They're not
less and less.
They're not doing that.
Yeah.
So this medical clearance for that isn't happening very often.
No.
And we all know that all the research about when you brush your teeth before you have a surgery and as soon after post-surgical, it just improves outcomes. Readmittance rates are lower. Of course, the pneumonias and all that kind of thing. But even educating our patients. So, Mrs. Jones, I have to get my hip replaced. I'm so tired of all this. It's really hurting, and I'm going to get my or my hip replaced. That's where you tell Mrs. Jones, listen, Lady Jane, make sure that before you go in there, I know your appointment is at 6 in the morning because you're diabetic and you're the first one that gets to roll in there. Make sure you brush your teeth, because I wonder how many people, because it's so early in the morning they have to show up, that they do not brush their teeth before they go in
I have
there.
honestly never thought about this, but that makes perfect sense.
It does, yeah.
It does.
I mean, that is the recommendations when we talk about when somebody mentions this rando thing in the practice. And then we would really love Mrs. Jones to make sure that she brushes her teeth. I even saw it with my husband. Knee replacement, they want him to walk, it's miserable, all the things, and he comes home and they want him to take all this medication, whether you do or whether you don't. When is the next time you brush your teeth? You barely can move.
Yep.
Yeah.
How long are you sitting with that before you actually get up and make it to a bathroom to brush your teeth?
Yeah, my brother was in the hospital for some major GI issues, and I went in and brushed his teeth for him.
Yeah.
Aww.
But I mean, these are post.
sister.
Think about this, because let me tell you, they run through surgeries down here in Texas. Like, it's a lot. There were a lot of people on that roll.
Yeah.
How many thousands every single day in just one hospital that this is doing? Thousands of patients.
Yep.
This is like truly, I have never once
Really?
considered this. No, like not pre-surgery, like just come back and see me, not what that implication is. Like, of course you're going to feel crappy after surgery.
Yeah.
And it's
It's-
tough. I mean, I'm
yeah.
not saying that you want to get up out of bed and go brush your teeth. You need to put something into place at least to how I'm not
Dry
going
brush
to
or
tell,
something.
to help people to
Yeah.
do that. And I'm not going to be a big swish and spit with products, but there is some things. Shoot, do they just suck on a little xylitol? But the last thing you knew is GI. If they've never done that before, you don't need
Yeah.
GI issues on
Yeah.
top of it
Yeah.
because they've got all the medications. But it's a lot that we as preventive specialists can talk about with our patients. Talking about that, there was an incredible nursing study in the Northeast. It might have been New York. They did it all on their own. And they did do research for this hospital. So the nurses made them at the hospital pre-brush, and then they post-surgical brushed. And then they looked at the numbers of readmittance compared to, they looked at the pneumonia rates that came after. It was significant differences. Why does a hospital not want to do that? Because that is a black check mark on your hospital when you get readmittance and when you get post-surgical pneumonia. That is a huge part of that.
Yeah.
Medicare tracks all that too. Medicare keeps all sorts of numbers. So that would make sense. And the nurses did it. I don't know if somebody put them into this pilot or we had some crazy nurse that wanted to do it. Yeah. That's my tip for today, ladies.
Yeah,
That's
that's awesome.
Phenomenal tip. I mean, that's very practical.
Yeah.
Just knowing, I mean, we should be having that conversation with patients anyway, checking their medical history and asking them any surgeries recently or upcoming surgeries.
Yeah.
Giving those tips.
Diagnoses.
And honestly, like I've had a friend who, she's in the holistic world, went in and had an extraction, and she was having major heart stuff right after her extraction. And she went to the hospital twice, thought she was having a heart attack
Oh.
right after extraction. And she was like, something's wrong. She's a nurse, so she knew, like, something's wrong. Like, I don't know what's going on, but check me. The hospital kind of fluffed her off a little bit. She went back, no, I need you to do a blood test and look for an infection. She was septic from the extraction site, and she was having
Right.
myocarditis issues at post-EXT.
Well,
So-
and that, I mean, I have that in one of my presentations when you get the real research of the bacteremias of, yes, I understand brushing and flossing and you can still get bacteremias, but what we do, scaling and root planing.
Yeah.
I'm not saying that everybody needs to be on an antibiotic if that's what somebody is surmising from this. I'm not saying that. But, yeah, there's bacteremias that will happen.
And then I've had a few people that, like, who are in the functional medicine side working with doctors, and we've had some conversations because one of my patients, actually I have two of them, that after clearing out the oral microbiome went into HERCs. So their liver
Oh,
was having a hard time and, like, dealing with all the endotoxins from the bacteria that we were killing in the
Right.
process. So then, we have to put them on liver support system. So now with the functional medicine doctor, before I start on the oral microbiome, she's putting them on liver support systems so their liver function is optimized a little bit better so they can deal with when the bacteria die, there's toxins that your liver actually have to do. If you have fatty liver issues, your liver isn't clearing and you go into HERCS, and HERCS is where you feel really sick after. And I have had a few patients with that. So even with the SRPs that we're doing, we have to start thinking about how the body is clearing some of that toxin issue and how that's impacting, like liver enzymes will rise.
Yeah. You know, Dr. Gina Pritchard, right here in this area, she's worked with Laura Hooper for years and putting somebody on a GI protocol because so much of it is gut.
Oh, yeah.
For periodontal treatment and things like that.
Yeah.
Yeah, there's a lot.
There's a lot.
You ladies are doing all the good work.
Thanks. It's exciting stuff.
It is.
Yeah.
It is. Somebody's going to have to take over. I'm going to retire. Not that I'm doing the good work, but there are a lot of us old timers that are heading out.
It's fun. It's fun to. So I want to thank you for coming on. I was super excited. And then, thank you for your...
I appreciate the offer.
Yeah.
Why, you obviously had never heard me on a podcast before. You're rethinking.
Well, I'm trying to add Kristen into the podcast. That's what I'm trying to do.
Oh, that would be fun. That would be fun.
I want to know, let's backtrack a little bit for people that don't know the Ann Rice.
Just a girl from Oklahoma. I'm a dental hygienist. I graduated in 1989 and worked clinically solidly. I took 4 months off when I had my son, about 20. He's almost 24. That was 24 years ago. And then we moved to Texas about 8 years ago, and I worked for a while and then basically did subbing. There was COVID hit at, one point, and I took a research job with an implant company of all things. And then during it's an ebb and flow. If anybody's going to tell you that it's unicorns and rainbows this whole career, they're out of their ever-loving mind. But what the challenge is to look at new things and re-educate yourself. And so I started really looking into oral systemic health and got involved with a group called AOSH that was all about that, and started just doing some more research, and I was interested in it. And then, you have intersections in your own personal life that you're more motivated to do things. And we had some cognitive issues with some family members. And so selfishly, I didn't want it to happen to me. And I was naive thinking we're just going to fix these people. So then we realized that. And then I looked at preventive strategies, and I came across a paper, Dr. Richard Isaacson, the first methods paper about how to prevent Alzheimer's disease. There was this little piece in it that talked about oral health. And I went, oh, baby, I know about this.
Yeah.
So for years, Saturdays, nights, weekends, all the things, I just really started looking into it. And it's those weird intersections that happen. So I did a webinar, and somebody was listening to it and sent me a LinkedIn message right at the time as it was going and said, hey, I want to introduce you to somebody. And that was he introduced me to somebody. They were doing a panel, so it's another podcast, another webinar thing. It was about oral systemic health. Did that. Somebody heard that was very random and said, hey, I want to introduce you to somebody. So I said, okay. And this was very organic. I'm not on all the socials. I'm not selling all the things. And they introduced me to Dr. Martha Summerman, and she was with NIH somewhere. She worked with Frontiers, and she said, I want you to write a paper. And I was stupid. And I said, sure, that'll be easy
Were
to
you
do.
Stupid or eager?
Naive. Writing an 800-page article in a magazine is very different than a peer-reviewed thing.
Yeah.
So I wrote it. Great. They wanted about Alzheimer's disease, and I really ponied up dentistry You're welcome. No, I'm just kidding. But I really
Thank
said
you.
that we were an effective healthcare field. We can really help our patients. And it's not just about the oral microbiome. It is about diabetes management. It is about cardiovascular health. It's about all the oral systemic things. And there were little sections in it. And I covered a little bit of it. And then it finally got published. And circling back, remember I said that I read that first methods paper by that doctor. He read my paper. And he reached out to me, and I was scared because the original first part of it, he wanted to have a meeting. And I was like, oh my gosh, I'm about to get crucified. Because I'm not a neurologist, for heaven's sakes. I mean, what do I know? I'm a girl from Oklahoma. So I did this meeting, and there were neurologists in the meeting, and he said, I like what you're doing. And he wanted me to work with him, and that was, I don't remember how, 2021,
Awesome.
I guess. And it's been from there, and that's my love. And then that's kind of gone out. You know, when I talk about nutrition, it really focused originally in the brain because there are certain things that we need. We get 30 nutrients that the brain has to have for good function. So that kind of where the nutrition came from. And then I got into science, and I started, Jackie was really let me write. Actually, today's RDH. I wrote for Kara first, and then Jackie, and I does some writing there, and then I have the column. So I do a lot of science. I just kind of like it.
I look forward to RDH Magazine for you.
Thank you so much. Be sure to write a constructive thing sent to Jackie so I can still keep a job. You know, it doesn't resonate with everybody. Some people find it too heavy science. I really try to drive it back that it's relatable and that you can understand. And, you know, I went to school in the 80s. We didn't talk about, holy cow, we didn't talk about some of this stuff.
It's shifting.
No,
yeah,
not at
it's
all.
fun. I can get in the weeds with reading research
And there's
articles.
new things. You know, there's lots of new things that are coming. One of the articles that I wrote, and you don't have to read any of my stuff. By the way, I don't get a kickback of $1.50 because you read an article. So do whatever you want. But I wrote an article a while ago about rapamycin, and it's been used in medicine, longevity. We'll just put it simply with that. Dr. Jonathan Ahn at the University of Washington got an FDA approval, and he is studying it in periodontal disease. That's what I like to write about. These are the things that you need to keep updated. What's going to happen? Where's our future going to be? So I want people to know, not that I know all of it, but if I find out something that's newer,
Yeah.
and I also want to give hope.
And this is a cool thing about like doing this is we get to share information, and everybody has their like bucket of super interests, right?
Right,
So
sure.
You get specialized in, and like
Right.
We get excited about like this is so cool, like
Yeah.
you know, look at this, and then we need hygienists like you who are sharing that information and,
Well, I
and
hope
getting it
so.
out there so that the rest of
We
us
do.
we
need
do
you in.
like we
Thank
and
you.
what it does is it opens the minds. Like it's about mindset, and what we learned in hygiene school is
Well, and it's also, we have to understand that, can you imagine your doctor, he graduated in 1993, and she's your doctor, and they never picked up another medical journal or new things ever again?
I think there are doctors out there.
There are, but you don't want it to be yours.
Right? Exactly. Exactly.
You don't want your dental provider to be the same way that I would be living in my 1980s strategies for. So we have to keep up. Whether you want to read the stuff, you got to keep up with the science. And I write an article, 800 words. Sometimes they throw me a 12, and then they make it into 2 parts, of course. But that's just the start. I can't surmise the whole thing there, that. So that I hope that just leads people to do their own research, to really critically think about and to question. I mean, none of us have all the answers.
I'm just going to start sharing
trying.
my email, and you say, hey, Ann, when you read a really cool article. Do you know there's like some really cool AI stuff now that you can take a PDF and make a podcast and listen to a little like.
Wow.
It'll do our jobs.
Yeah.
Yeah, we don't. Why are you sharing that?
No.
And today is the last podcast. So.
No, but for some, I'm nerdy. I like as I'm working and I'm trying to really build some really cool education stuff because that's where I would like to go.
Yeah.
Eventually, I'll be speaking. I'm working slowly
will.
at it. But, you know, it's really fun just to kind of like veg out and make my slides and then listen to oh, this is a cool research article that I want to dive
Yeah, I
into a
get
little bit.
to. I get so many
Right.
in my inbox that I have to keep up with, and I do that all the time.
Yeah.
I do like some.
So if you don't have time to read because you're multitasking, it's fun just
Right.
to listen to like the synopsis and kind of
Yeah.
they pull it apart for you. I mean, you
get-
still have to read the article but it's fun just to kind of nerd out for a minute on the PDF of the
Yeah.
article and have someone kind of explain it to you in simple terms.
I get a little nervous with AI because we don't want them to write our articles or take away your podcast and all
Yeah.
of those things. But
It's an
Yeah.
amazing tool, but
it is.
yeah.
And I, it is a great way to, when you just put in a word and you want just an explanation of something, to give lots of different ideas and all that. But I listen to podcasts, all different.
That's all I do. I don't watch
to a lot
the
of
news.
different. I listen
Yeah.
to a lot of science ones.
Yep.
And you really have to watch about that.
What are some of your
I
favorite
know. I was going to
podcasts?
ask the same thing. What are some of your top 5?
Oh, I don't know, top 5. These are not going to be. You're going to go.
Top
the girl
three.
is an idiot.
Is it The Art of Manliness? Because that's one of my favorite ones.
No,
He's so good.
really.
Brett McKay.
No,
Yeah.
I just some classic, because I listen to Dax Shepard,
Oh.
Armchair Expert, and I listen to everyone. So they have science on there. There's lots of random science. He does his research. He and Monica both. And there's celebrity stuff in there too. I do some really silly things.
I didn't know he had a podcast.
Oh my gosh. We're called Armcharies. Armchair Expert. And here's a cool thing about this, and this is important for dentistry. I'm not trying to sell Dax's podcast, even though Dax, hey. My boss, Dr. Isaacson, was on that podcast talking about preventive neurology last year, and they did diagnostics, so they did a lot of the testing and all that. There is supposed to be a follow-up podcast to that sometime where they're going to go over their results, and I believe they did get salivary tested.
Awesome.
So that was my whole hope. And our Dr. Isaacson said, I'm going to try to lay the oral health in there. He really throws me a solid as much as he can. But a lot of stuff ends up on the cutting room floor. So that would be in my world, and what I've wanted to do so much is I want the public to understand about oral health. If I can retire where things like that happen, especially that demographic, I think they're younger,
Yeah.
that they understand how important it is. But yeah, I listen to that. I listen to silly ones. I don't even want to tell you some of the ones
I know. I'm intrigued. I'm more
listen to
intrigued.
Smartless with Sean Hayes and Will Arnett and
I feel like we're getting a whole different side of you, and I love
Oh,
this.
if you only knew I have guilty pleasures all the time. It really got too out of it. The balance was wrong for some years, where the weekends were, and if my husband hears this, he's going to go, you haven't found the balance that you can just
I think that's
humor
that's
yourself.
a challenge for my husband.
But
too,
I mean,
so.
just on the weekends, when you work out of your home in your office, you walk to that room, right?
and you get sucked in.
And you just answer emails and
Yeah.
do the research and all
Yeah.
that kind of thing. So I listen to really rando things. I have watched Real Housewives of franchises.
Okay. I live in Salt Lake, and that one was a guilty pleasure, and I feel like a less human for watching it.
Yeah. I mean, it is telling you how other people live, or it's I'm sure a lot of
It's
it's
gotta
curated
be.
and all that
Yeah.
stuff.
The
but
one for Salt Lake was so juicy. I was following that court case.
somebody went to prison, didn't
Yeah.
they?
She did.
Oh,
All people where you live go to prison? I'm just kidding.
Well, so fun fact. They just recently moved the prison from one part of Salt Lake over by literally the Salt Lake where the flats are drying up. And hello, it's marsh. The foundation is crumbling, so they can't always get the doors to close
Oh.
in the prison. It's a hot mess.
You've got to be kidding me.
no,
That's
and it's
fun.
brand new.
So
Wow.
I guess what this means is if you're an engineer, Salt Lake has a lot of openings.
Oh.
Because they haven't been
I
utilized.
don't know what they were thinking.
And the same thing
That's-
applies. You can't build a house on a swamp, right?
You're
That's
right.
Well,
no,
not in
it's a-
Utah.
right,
They're
right,
going
yeah.
to. So
I
don't
was
know
in
what they
Salt
were
Lake
thinking.
for an event. It was a chemist event of all things. It was my first time there.
It's beautiful.
Yeah. I tootled around, and the library there, because I am a big library. I go to libraries in every city.
How long ago was that?
Year.
Okay.
It was the new contemporary looking library.
Is it like also slightly a homeless shelter?
Correct.
Yes.
Oh.
I was so fun fact.
Yes.
When I did
I didn't want to
podcast-
mention that, but you're outing your own city. So go for it.
Not my hometown, so it's fine.
Okay.
No, we recorded, not me and Heather, but I did a previous podcast with Hygiene Elevated. We recorded our first podcast in that library. And cool things there, they have a seed library within the library.
Oh,
You
that's
can
fun.
take seeds.
Wow.
That's like the most Utah thing I've ever
Yeah.
experienced.
It
But
was.
You had
it
to
is-
fight through some homeless people to get
It's
there.
a beautiful, beautiful library, and yes, it is. They have air conditioning and all the things. There were a lot. It was really. It was. I loved it,
Yes.
and I walked down there. I didn't feel unsafe. I don't feel unsafe very often. So
Yeah, in Salt Lake, you can still get through the homeless people and still feel safe for the most part.
yeah, I liked it. It was Salt Lake was nice. The people were friendly.
Yeah. I've never been. Yeah.
I
Maybe
mean, I didn't
someday.
stay long
Oh.
enough, which is
Yeah,
what
come visit.
happens. You should go.
Yeah.
You have a friend that you could probably rent a room from.
Possibly.
Must love dog hair.
How many dogs do you have?
One right now. I lost my guy last year.
Oh,
And my other dog, Lady, she is our princess queen of the house. She actually slipped a disc recently.
oh no.
I thought she hurt her hip. Took her to the vet. He overprescribed gabapentin, 600 milligrams a day for a 68-pound dog. Paralyzed her. She is now in physical therapy, living her best life.
Well, that's a vet.
That is a medical professional that has lost their passion for what they do.
Go Salt Lake.
Woo.
Everyone
Well,
should go.
She is recovering, though. and
She is
can walk now.
recovering
Well, that's-
well.
Glorious.
And she chased a squirrel this week.
She did chase a squirrel this week.
Well, that's when you know they're on the road to recovery. Mine has a really good job of barking at them consistently.
But to that point, so physical therapy, I didn't know physical therapy for dogs existed. I, as a Hail Mary, because we were already mentally like, we're going to have to put her down. She's paralyzed from the waist down. Like, this is not a good thing. Just Googled physical therapy and found a animal physical therapist, which would only happen in Salt Lake. But yeah, he PhD.
Wouldn't that be a fun job?
Yeah, he lives
Dog
his best
physical
life.
therapist. Let me sit and pet you. He's like rubbing her.
He pretty much just pets dog all day long.
Yeah.
Like
I
that's
was going
what
to
he
say,
does.
I could be a dog massager. That would be fun, rubbing their little paws and their little legs.
He says little dogs are the worst. Little dogs are
Yeah.
the absolute worst because they move around too much. So
I
he
do
does
watch-
like needling.
Oh, really?
Oh, here I've
just
got
like
video. I
a
got
just
video.
like a human.
Just like a human. Yeah.
They did that. I had to have some shoulder surgery, and those are not exactly the most less painful things.
Dry needling.
Dry needling,
all-
and then he hooked up electricity to
the electrode. That stuff is what I had on my shoulder. I
Yep.
got pet her though.
Yeah.
She
And
felt good.
This is that's
Oh my!
yeah. And the tens,
And it looks like your dog won't ever smoke again with all of those little acupuncture points.
I was a little worried about her with that, but she's
She's
And
recovering.
any
really
eating
from-
problems that the dog has, those little acupuncture points would be just all cleared up now too.
Right.
oh gosh.
Can
yeah,
you
so-
teach the dog to do dishes now?
No, I feel like she has taught us even more to do dishes. She gets weighted on hand and foot. So during this process, she obviously lost her appetite
Yeah.
a bit. So I was doing everything possible to get her to eat nutrition. So she definitely went through a solid week where she would just lift her head and we had
Oh.
to feed her. It was
Milking it.
she knows.
I-
She's got us wrapped around her.
I only
pinky.
have grand puppies.
Oh, they're
they
still
come spend the night.
puppies are puppies. That's good.
So
So my podcasts are I listen to all sorts of, I do not listen to, I read true crime or crime mystery and that kind of thing, but
you
I
would
have
fit
never
so well in Utah.
listened to, I could make some jokes, but I won't. Because
they are
someday I want to
based in
speak in
Utah.
Utah. So I am saying nothing. But
So maybe
I
when
am.
you speak in Utah, you let us know, and then I'll come stay with Amanda, and we can go.
yeah,
Yeah.
I love
I wanna
that.
do
Well, what do you want to speak at? The UDA or UDHA?
I don't know. I'll speak to any. You know,
Shout out
I
Utah.
love doing all of them. I like doing big groups. I've done dental organizations, these kind of things. But there is some fun to study clubs and things like that. Like the bigger one where you can really connect with the people. So I have had some great experiences. I went up to Montana. There was a periodontist that saw me speak somewhere, and he said, I want you to come up here. Because you know how periodontists have these hygiene, and they'll have a speaker come in, and there'll be a couple hundred people. All their referring doctors will do this nice get-together. And I spoke to a couple different I did it 2 days, a couple different groups that he had. And you just find sometimes some of those communities, they really want to hear information. They're not just waiting on their phones to click a CE code. I just love some of that.
Yeah.
And then the doctors that I meet there are really real. Not all of it's good. They all have good parts to it. I hope that some of the stuff that I talk about resonates with at least one person. But some of that's kind of fun. It's a little more intimate.
Yeah.
Some of the big rooms, it's lovely to have 500 chairs in it, but if there's only 350 people, then everybody is all spread out and it's less one-on-one. But anywhere is fine if somebody, wants to hear what I have to say. I have a webinar coming up that is about sleep. Now, I'm not an airway person. I always want to clarify that. When I talk about sleep, it's about health. It's about all the biological parts to sleep and things. And when I used to do long courses, that was the second one. I would do one thing in the morning and that in the afternoon, which was insane. You're talking about sleep after they ate lunch. Idiot. So this one is going to be at night. Here we go again. So everybody will be, I'll get them
webinar
rocked
planning
right
with
out.
Ann Rice 101.
Yeah. Do not follow my playbook on any of this career stuff. That is definitely not it.
But do you regret any of it?
It's worked out well for you.
Oh, no. I can't have, no. Heck no. No, not at all.
It's what developed you to be you.
Oh, 100%.
I do it very uniquely. I am not like, everybody's their own individual, and it works for me. I mean, there's always improvements all of us can make, but I'm not, if you go to my Instagram, sure, follow me on Instagram. I like dog videos. I do some of the dental stuff, but I'm not as out there in social media. You girls are younger than I am.
I struggle with that. Like, Amanda's great at it.
There are some great
I'm
people
trying really
here,
hard,
though,
but
we could learn a lot from. There are some really social media experts. Part of my problem is what we're doing here, my voice. I'm not loving it sometimes. And then being on video makes me uncomfortable some.
Sure.
But you can be in a room with 500 people.
I know.
They're far away from me. You're not up in my stuff. And you're also
stunning.
not blowing up the screen to go, gosh, look at those wrinkles. Oh, my gosh, how old is she? 74? She looks
Are
good.
you kidding me?
You are.
No, girl. No, this is my
I was like, wait, what?
60th year of life will be in about 3 weeks.
Well, happy early birthday.
So, thanks. I don't know what we're going to. This is it, under one roof. I'm celebrating right now. My birthday. No.
Awesome.
Okay,
Yeah.
one last thought.
Yeah.
Before we really wrap up. Okay, this is a super random thought, but kind of going back to the idea of the autonomy for hygienists. Don't you guys always think, like, who is the hygienist for these representatives? Like, all of these senators and House of Representatives, whether it's the state level or the national level.
that's never crossed my mind.
How are they not getting influenced by their hygienist? How is that
hygienist-
not a thing?
If you are working on a senator or any of the political guys who are making a big difference, you better start talking to your people.
That's really
Always
easy
been
if
my
you want to
thought.
break that down, though.
The dentist is like, you keep this hush hush and don't say anything.
No, you're
Don't open
gonna
your mouth.
vote for the influence that is coming, not just from that one single hygienist. They have lots of people that they have responsibilities to that have lots of influence.
And money.
I think some of them just don't know. Also,
Yes, I think there are those that
They really
maybe
don't.
would appreciate actually hearing from a hygienist. Back in New Mexico, I had friends that were representatives to our state legislature. So I got to go up for legislative dinners and things like that and hobsnob with them. And I got to sit down with a group of legislators, and I forget what kind of bill was going through the House at that time in New Mexico. And I graduated in 2008 from the University of New Mexico, where autonomy has been a thing since I graduated.
Wow.
I didn't know it wasn't a thing. I've always considered New Mexico to be such a backward state. In so many ways it is. I didn't realize how progressive it was for hygiene until I moved out of state. And I was like, wait, I can't administer anesthesia without the doctor here? Wait, what? Wait, what? So, and
Well,
yeah.
Or
and that
at least you
admit-
could, yeah.
that you can do it.
Yeah.
Yeah.
Or laser. Like, it's hard. Like,
It's
in
also-
some states where, like,
Yeah.
if they're, like, I have to ask, like, are you allowed to give laser, like,
Yeah,
therapies in your office?
initiated tip or not, and
Yeah.
all of the. Yeah, it is very. I live here in Texas now. Oklahoma was pretty progressive.
Yeah.
Which
'Cause you
I
guys
didn't-
were one of the first Botox people.
Yeah, which I haven't done that yet. I'm not living there right now, but to be able to do it. But local anesthesia, I mean, I graduated Kansas. I went to school in Kansas. It wasn't legal there, but then I went to Oklahoma and it was. So we got a weird thing in Texas with nitric oxide. You can't turn it on. There was a moment in the policy legislatively that it was written that you couldn't turn it off. I'm sorry, if somebody's going through a crisis, I'm going to do some adjustments.
I'm going to do some illegal activities.
Right. Take me to nitric
We
prison.
have to go
but
for certification in Wisconsin for it. And I think Wisconsin is fairly progressive, too, with what we're allowed.
I mean,
I've
I
been doing
understand you got to be
anesthetics
trained. I mean, you know, the train, but really, anesthesia, all the things. I don't understand. I don't know how this has happened. Somebody could give me. I don't want to know the history of it, really. But one state you could do this, one you can't do this. I can't go to your state. You can't come to my state. I'm qualified in these states. I'm not qualified in those states, and
Qualified for Alabama.
right there are. You know what? There's representatives of every state at this meeting.
Yeah.
There is someone from every state. And then I forgot what the list of countries were.
Were there like 14? Is that what they said?
Yeah.
Something like 14
Something
different countries,
huge.
50 states.
I mean, we know Turkey, Thailand, and Canada for sure.
yeah.
Yeah.
So I'm sure
I don't-
Mexico.
Well, this is probably politically. I don't see Canada. Obviously, they are not the United States, but here they just seem like our friends. And
Yeah.
it's not like they're far away. They're just
I
right
train a lot
there.
of people in Canada. It's super fun.
Yeah.
Yeah.
They've been lovely to me. I've had a few little things up there, and
And in some of Canada, they can practice independently. Yeah, I talked to a hygienist
yeah.
from Canada.
oh yeah,
Tooth Life
absolutely.
Irish,
I've
for sure.
referred to a practice up there, and she was independent.
Yeah.
She was on her own. Heck of a practice. But
It's really these independent hygiene practices that are.
I know.
I mean, Pamela Ames out of Maine. I grew up in Maine, so super fun. She's got a little shed that she has out back that's beautiful. She's doing GBT. She's got phase contrast microscopy.
we considered Maine a little bit.
Yeah.
I like it there.
Yeah, and you can practice independently there.
Yeah.
And they're increasing access to care because there's so little dentists. that
They
you
also
can-
had a hospital hygienist.
Yeah.
That was a position I actually saw.
Yeah.
That is and as we wrap it, that is my whole thing, is that I would love, I'm not going to say the negative part of it. I would just like to pluck out hygienists. You can stay in a restorative practice. There's all good places for all of us to be. But I would just like to pull a hygienist out into every medical, at a hospital, having privileges, whether it is education, doing the actual work, all the different things that we could do, assessments. I'd like to put us in every hospital and every medical, especially big medical groups now, because they're all groups. There's hardly ever a single shingle anymore, that you could have the capacity to do that.
to practice collaborative, like
Yeah.
truly collaboratively.
Yeah.
I don't think it would be that difficult. And if, in fact, we are a money sucker, not maker, then let me go. Let me go somewhere else.
Let me practice preventatively like I want. Yeah.
I
Awesome.
technically, when working in some of the neurology world that I am in, technically I can't even open any of those patients' mouths. But a medical assistant could.
That's so dumb.
Yeah.
They have no clue what they're looking at.
And thank you so much for joining us today.
Thanks,
Those are-
ladies. This has been fun, and this
Yeah.
is a nice little wrap up for me.
Yeah.
Feels
yeah.
good. So you could cut the whole thing apart.
Yeah.
We might do 2 parts.
Oh no, I'm a two-parter.
You're a 2-parter.
I talk too
I need
much.
12
I write
No,
too
no,
much.
like,
I'm a
yeah.
two-parter.
we are really good at of making really long podcasts. So we were like, maybe we should do this a little bit shorter, but I think we might do it in 2 parts.
Okay.
So people can really have enough time to spend and dive in and not feel like, oh, this is an hour long.
Yeah.
So
Or put it on
hard.
speed too.
Yeah. But yeah, thank
Thank you
so
all
much
very
for your
much.
time.
I appreciate it.
Yeah.
Thanks.
Safe travels.
Thanks.